Hi, it's counselor and educator Dr. Greg Jantz. Just wanted to let you know that the topic of OCD, obsessive compulsive disorder, can be confusing. I'm just going to go super fast and just share. I made a couple quick notes. Mild OCD, and there's going to be a lot more information in the article in the blog that follows, but I want to give you a quick overview so you know this is something that we've seen. OCD is an anxiety disorder, and we've seen this increase over time over the last this is our 40th year, and we're seeing this increase as far as people suffering from OCD. Now there's the mild OCD. Here's what it's like. It's those little things that you may be ruminating about, little things, and you may find, oh, I gotta go check that again, whether it's a door lock or did I turn off the water. There's a beginning of a need to check something. I need to check it because I need to lower my anxiety. Mild, and look at this on a continuum from mild symptoms to very severe at the other end, which is just generally disabling. It's taking charge of your life. All right, there's obsessions and compulsions, number one. And it's those intrusive thoughts. Sometimes it'll surprise you. And you go, I'm not going to think about that. Not going to, and you're thinking about it. It's got you. Intrusive thoughts. And then there's the repetitive behaviors. So remember, it always starts in the mind. I ruminate, I recycle. And before I know it, I'm doing a behavior. I'm seeing this whole thing of germs. I can't get clean enough. Did I wash my hands long enough? I better go wash my hands again. So those kinds of things. There is a very clear functional impact. It's causing you distress, but it's not interfering so severe in your daily life that you're quite ready to do anything about it. And you may go, okay, this is just the way I am, and you live with these mild symptoms of OCD. You might even joke about it. Okay, but then as time goes along, it begins to have an impact on your life, an impact on your daily functioning, an impact on your daily joy and happiness. And you realize, man, I'm getting more and more anxious. You got to do something to take the edge off. Maybe you start drinking alcohol. Okay, here's some signs to be aware of. This is going to go quick. Frequent checking, as I mentioned, but just checking this or that. Did I put out the garbage? And you've checked it 3 times. Those kinds of things. There can be a compulsive tidying up. I've got to get the papers in a certain order. And I got to wipe this counter. Okay, wait a minute. And you question yourself and you go back and you re-engage in the behavior. So that's one. Impact on daily life. Here's what we have to look at. Certainly there's an emotional strain. It pulls you down. It captivates your thoughts and thinking. So it's feels like an oppression, something that's, I can't seem to shake this off. I can't shake it off. It's an emotional strain. It's an emotional drain. It's frustrating. And you start to question yourself, go, oh, am I losing my mind? What's going on? And you do. Ultimately, you question your sanity. The other impact on life is just the time it takes. There's time-consuming rituals. Over time, these take more time. Not your entire day yet, but what is developed as rituals starts off as a routine, turns into a ritual. You're doing it over and over. So, all right, how do we diagnose mild OCD? It has to create, ultimately, enough distress in my daily functioning that it's interfering. I'm not fully able to do those things I need to do, or I'm avoiding doing those. Self-awareness. People with mild OCD, they recognize, hey, I know this is irrational, but I have to do it. I know this is a little crazy, but I have to do it. Hey, there's some great options for treatment. somebody that really understands this, that can, and some of the things that we do with cognitive behavioral therapy, CBT, helping you change your thinking. There is something called ERP. This is exposure and response. This gets a little complicated. We don't do this with everybody, but it's exposing you to those things that you fear, causing you to face those. There's only certain people and certain ways to do this that are really effective. There's also DBT, dialectical behavioral therapy. We're using that more and more, but there's tools, there's things that can be done to help with emotion regulation. And yes, there reaches a time with obsessive compulsive disorder that it can be really disabling and throws you into really some depths of despair. You do feel like you're losing your mind. Tends to get worse. Mild OCD tends to move along the continuum. It's one of those, it just tends to be progressive. So get more information here in the blog, the article, and let's make some decisions so this does not continue to progress.